Alright, so I'm P11, nurse practitioner, and we're going to do a head, eyes, ears, nose, throat, skin, hair, and nails exam. Are you okay with that?
Yes.
Okay, so first thing I'm looking at is the head. It's symmetrical. It's norcephalic skull. Yes, norcephalic skull.
Okay.
There's no lesions. There's no redness. Any tenderness?
No.
Okay. There is a macular mole right above the right eyebrow. It's about 2 centimeters in length. We're going to feel your frontal and your maxillary sinuses. Any tenderness with those?
No.
Alrighty. There's no swelling on the lips, nose, eyes, ears, forehead. Skin is tan and smooth. There's facial hair on the upper lip, jawline, cheeks,
You bet
head.
there is.
Huh?
I said you bet there is.
I can't see any enlarged lymph nodes, no pustules, no exudate. We're going to go to the neck. The neck is symmetrical. Can you move your neck around in a circle? Okay. Up and down, sideways. Full range of motion. Trachea is midline. Then we're going to go for the lymph nodes. We're going to be preocular, which is in front of the ear. Postocular, which is behind the ear. Parotid is the cheeks. And we're going in a circular motion. Submandibular. Submental is the chin. We're going to go superficial cervical and deep cervical. And we're going to make sure to get the posterior and anterior cervical. Any tenderness with any of those?
No.
Right, I'm not feeling anything either. Go ahead and open and close your mouth for me. Did you hear a clicking noise?
No.
So no TMJ for those.
Did your computer turn on?
It's still on. Yes.
Is it recording?
Yeah, it's still recording.
Okay. Sorry.
It's all good. Eyebrows are even on both sides, symmetrical. There's eyebrows and eyelashes. We're going to go to the eyes next. So what I'm going to have to do is do the Snellen chart first. So I'm going to move my chair. And I'm going to have you stand right across the side, right where this is. It's going to be about 20 feet.
Okay.
All right.
You can't see me, is that okay?
It's fine.
Okay.
Can you read the 2020 line?
XDFHPTZAN.
Okay, well that's 2015 line, so you're more than normal.
I can't see the number.
And what about the 2010 line? Can you read that?
FAXTDNHUPZ.
Okay, so your vision's 2010, so you can see at 10 feet what normal people can see at 20 feet.
Okay.
You don't have
LASIK.
I'd say you don't have contacts or glasses, incorrect?
No, I
You
got
got
LASIK.
all right. You have a seat right here. Alrighty, I'm gonna switch out my tool. We're gonna put on the lights. Alright, we're gonna do the confrontation test since you got a 20 out of 15 on the Snellen test. We're gonna cover the same eye, so let's cover right eye. And then tell me when you can see my hand or the numbers I'm pointing up, okay?
I can see it too.
Okay.
I can see it too.
Okay. Left eye. And same thing.
I can see it too.
Okay.
I see it too.
Alrighty. And we're going to do the 6 cardinal gazes. So just follow the pin light with your eyes only. Alright, and that is a normal exam. We're going to do the pupil light reflex. So I want you to stare directly at my nose. And we're going to just dim a little bit. Normal dilation. Normal dilation. And they both react the same way. Next we're going to do the red reflex. So just look straight ahead for me. Yeah, now it doesn't want to turn on. There we go. Now it turned on. So I'm just gonna bring the light closer to you. Just keep looking ahead, okay? Ready? All right, and they are orange and red optics disc. The veins are larger than the arteries, which is normal. There's no AV nicking or cotton wool spots. Both eyes are symmetrical and reactive. The sclera is white. So I'm gonna have you look up. I'm gonna pull down a little bit of this. Conjunctiva is red and moist. Go ahead and look down. Same thing. Right? Sclera is white. There are no ruptured blood vessels. No nystagmus, no foreign bodies. There's no oozing out of your eyes. There's no discharge. They're symmetrical. No redness. No edema. You do have brown eyes. All right. So for your nose, I'm going to feel it. Any tenderness?
No.
All right. Your nose is symmetrical. It's not overly large or small. It is midline. There's no drainage, I see. There's no redness, swelling, no discharge. What we're going to do, if it's okay with you, is go ahead and look at your nose. There we go. All right. And then if you'll just tilt your head just slightly. All right. We're going to put your nose up and look. It's red and moist. You do have a deviated septum, which is all right. There's a little bit of boogers in there, not much. All right, there is nose over here is good. Everything looks, there's no abnormal findings in there, so there's no blood clots, anything like that. I am gonna do your hair because I forgot to do that for the head. Hair's thick, black. It's healthy. It's not dry or overly oily. No bald spots or missing hair. You do have a few gray hairs.
Yeah, I know. I'm getting up there. 30 hit me hard.
But you have normal patency. You don't have any trouble breathing, do you?
No.
All right. Do you snore at night?
Snore?
Yes.
No. Well, sometimes.
Okay. But there's no redness, tenderness, swelling, edema, pustules, anything like that. Okay, your lips are pink, moist, they're not dry, they're not cracked, there's no edema, there's no redness, drainage, there's no sores on them. They are symmetrical. Go ahead and smile for me. Alright, your teeth is white. Go ahead and stick out your tongue. Alright, can you move your tongue up and down? Up, and then side to side? Okay, sounds good. So you have full range of motion for your tongue. Mouth, go ahead and open up for me. And I'm just going to use my light again to look in your mouth. Open up nice and wide. Alright, no missing teeth, no cavities. The teeth are white. Everything is moist, the gingiva and buccal mucosa. And any tenderness when I touch this?
No.
Alright. Any tenderness of your teeth?
No.
Alright. There's no teeth that are loose. There's no swelling in there. There's no bumps, lesions, anything like that. Exudate. You do not have not a thyroid. You do not have your tonsils, correct?
No, I got them taken out, yeah.
Okay. So when I looked, your uvula was pink and moist. You don't have tonsils, so I'm not going to palpate for those. The posterior wall of your pharynx was pink and moist, and it looks completely normal. I would enlist a gag reflex, but we don't have to do that for the video. No tongue depressor.
Good. Yeah, I'll be throwing up all over.
We're going to go to your ears. So your ears are symmetrical. There's no redness. Let's see if there's any tenderness. Any tenderness?
No.
Alright, no swelling, edema, lesions. They're the same size. They're not overly large, not overly small. We're going to go ahead and look in them. Make sure my light's on. Alright. And we're going to go ahead and look, and I'm going to tilt this. I'm going to pull up and back. A little bit of earwax, not much. Tympanic membrane is gray and pearly. Everything else is pink moist. It's not overly red. There's no signs of infection. Just a little bit of, like I said, yellow earwax. But nothing like discharge-wise. Your tympanic membrane's intact. Everything like that. I'm going to do the same thing. Up and back. Might help if I do this arm. This one has a little bit more earwax, but I can still see it. It's not much earwax. Pearly white tympanic membrane. I did see the light. So those look good. We're going to do the whisper test, which we're going to block one of your ears. I'm going to whisper something to you, and I want you to repeat it back to me.
Okay.
We're going to do both ears.
I didn't hear you. 5. 7.
Perfect. The cone of light in your ears also, the right side was at 5 o'clock and your left one was at 7 o'clock, which is normal. We're going to do the Weber test. So I'm going to take this. I'm going to hit it so it activates it. I'm going to put it right here. And you're going to tell me when you can stop hearing it on both sides, okay? Whoop.
I can't hear it now. Okay, I stopped hearing it.
Okay. And then we're going to do the rhyme test. So I'm going to do the same thing. Put it here. When you stop hearing it, let me know. I'm going to put it up against your ear. When you can't hear it anymore, let me know.
Alright, I stopped hearing it.
Okay.
I still hear it. Okay, I stopped hearing it.
Okay, we're going to do the same side, other side.
Alright, I stopped hearing it. Alright, I stopped hearing it.
Alright, and that's good because the AC should be 2 times greater than the bone conduction. Air conduction over bone conduction. Alright, then we're going to go to your hair, skin, nails. You want to put your arms out for me. Alright, we're just going to feel the temperature. It's warm, dry to the touch, even distribution. Do have a small scratch right there, about 4 centimeters. Fingernails. You have all your fingers, which is good. Capillary refill is less than 3 seconds. There's no clubbing. Fingernails are not overly thickened. You have all of your fingernails. There's no redness, bleeding, pussing. Do you have a little bit of a blackness on your cuticle right there? But everything looks dry. They're the appropriate color. Underneath your nail is pink. We're going to do a skin trigger, so I'm just going to pull your shirt down just a tiny bit. Alright, and you have no tinting, which is good, so is hydration. Patient overall has good hygiene, there's no odors, he looks well nourished, takes care of himself. I think I hit everything, let me just make sure. Oh, I do need to listen to your thyroid, and your carotid artery, and then your temporal artery above the eye and thyroid, and I'm going to listen for a bruit, which I should not hear. Okay. Okay. 10-4. Okay, no bruise found, and I'm actually going to do your thyroid. So sit right here. Look for your thyroid. All right, any tenderness?
No.
Thyroid's not enlarged. Alrighty. Go ahead and swallow for me. Alright, everything normal exam there. Wasn't enlarged, it wasn't moving in an inappropriate direction. 13J. So basically there are, your skin's warm, dry, smooth to the touch, even hair distribution everywhere, no redness, drainage, exudate. You do have a macule, but there's no exudate, about 2 millimeters in size above your right eyebrow, but no abnormal findings for your thyroid. Your ears sound good. You can hear high pitch and low pitch. Your vision is 20/15, which is excellent. And do you have any questions or anything?
No, no questions.
All right. And then your macular and lens are clear, so you look good for that. All right. Thank you.